So, Namaskar everyone. My name is Dr. Manish Yadav. I'm a homeopathic consultant from Mumbai, India. So, welcome to this series, this talk of sharing and learning nosodal remedies, the anti miasmatic remedies, especially the remedies that we use intercurrently. How to identify those remedies. In the last talk, we learned about Medurinum as a remedy and different aspects of Medurinum, how to catch psychosis and how to find out and give Medurinum. Today we are going to take a remedy, and this remedy is one of my favorites remedy because this remedy, I feel it is a remedy of this age. As I said in my last lecture, psychosis is one of the things that you should learn more because that is one of the biggest miasmatic, picture that you will get in today's arena. But along with that, this remedy that we're going to talk about is a very important remedy for today's generation. And the remedy's name is thyroidinum. Of course, you know by the template. So thyroidinum, how to understand? There are various parts of it. Now look at thyroid disease. Just look at thyroid disease. There are so many thyroid people who are on thyroid diseases. Okay, and allopathic system or the conventional line of treatment puts them on the medicines that they have. Of course, the L-troxin and thyroxine, वगैरह. But there is a thing about thyroid which is said that it cannot be cured. You have to keep taking. But I can tell you, I have got many patients. And in fact, not only me, but many of homeopaths can give a lot of testimonies where thyroid can be cured, thyroid can be managed properly. But definitely, this talk which we are going to do that we're going to talk about thyroidinum. So if you're thinking that my thyroid patients will need thyroidinum and it will get cured, that is not the thing. Individualization is the most important thing in homeopathy. So there is no specific, no therapeutics. There is no role of any therapeutics and specific in homeopathic practice. Though in many thyroid cases, you can use, if the indication match, thyroidinum is one of the remedies. But there is something beyond the disease thyroid that we should learn about thyroidinum. It's a wonderful remedy. And before I begin, I'm going to tell you that all the information that I'm sharing today is a collection of data that I have done through my practice, through my learning, and a few books. Especially the background is Handman's miasm, Allen's miasm, and Ghosh clinical experience. Now, Nash, sorry, not Nash, Ghosh rare nosodes. There's a wonderful book, Ghosh rare nosode. If you can get that, you will get everything whatever I'm saying. Major of the point, especially for this talk which I am doing, is from that book. So let's not waste time and go directly to the PPT and let's try and understand thyroidinum. Just a minute. Yeah. So first point, thyroidinum as a remedy is for the conditions which point towards loss of balance in human economy due to due to some kind of strain during a particular period of development. Now, I have marked this line, period of development. I would like you to keep this word in your mind because this word is going to come again and again, again and again, again and again. This word, development, is the keynote or the central point or the genius of this remedy. If you understand this, then thyroidinum as a remedy, as a drug, will be very easy to understand. So some kind of strain that happens in the economy, particularly period of development due to climatic variations, to some mental or emotional factors. Thyroidinum in potency is one of the most useful, important remedies. So this is what is said. Ghosh says that thyroidinum is one of the remedy for the conditions for loss of balance in human economy. So in human economy, some loss of balance happens. Why? Due to strain, too much strain on the particular period of development. It could be any cause. There could be climatic cause, mental cause, emotional cause. But what gets deranged? Development, period of development. Now, what is the meaning of this period of development, and which is the point in the generation of like human cycle, the development, where you can see where it gets halted and how it affects? Let's try and understand that. So when prescribing thyroidinum, more attention is to be paid to this basic condition in the background. So wherever you will think of thyroidinum as a remedy or as an intercurrent you're prescribing, or even as a remedy you're prescribing, you have to keep in mind the basic background of this development. Somewhere there is some halt, there is some disturbance, there is some lack, or there is a hindrance to the development of the individual. The cause could be anything. We say many times hormonal issues. But what happened after hormonal issue? If there is some developmental issue which is coming up, then thyroidinum is one of the remedy. So all the symptoms are connected with want of metabolic, nervous, and vascular adjustments, or combination of all of them. So once you have written period of development, now write down metabolic, nervous, and vascular. Metabolic disorders, vascular disorders, and nervous disorders. This is the way the body will manifest its symptoms. A homeopathic doctor always, we find the remedies through their manifestations. So how will thyroid manifest physiologically, if you want to understand? Metabolic, nervous, and vascular. Now, what is metabolic disorders or metabolic symptoms? Metabolism basically means when the process of converting food into energy. So whenever metabolism is affected, it can be affected by various reasons, or it can be affected by lifestyle and the food habits, the diet, or maybe organ deficiency. So there are different symptoms for metabolic disorders. Like, of course, the bigger ones are diabetes itself is one of the metabolic disorders. There could be nausea, vomiting. There could be headache, migraine, weakness, all those things, right? Nervous. So all nervous symptoms, especially seizures, or nervous phenomena that is coming up on the body. Vascular. Vascular means whenever there is issue with contraction and dilatation of the capillaries of the extremities or the vessels. So generally the hot flushes, high rise of blood pressure, suddenly after hot flushes, body becomes cold, body becomes hot, body becomes cold, extremities become hot and cold, chilliness and then hotness. You will see a lot of patients say, I get hot and then again I feel very cold. This is sudden change in this is vascular symptoms, means the extremities, the vessels on the capillaries which are there, their contraction and expansion is not happening properly. So how we will find out thyroidinum symptoms? Through this metabolic, nervous, and vascular. Don't worry if you're not understanding right now. As we go, just keep these things in mind. Period of development, metabolic, nervous, and vascular. As we go on and see cases and go deeper into it, you will understand everything. It is very simple. And day-to-day practice, you must be seeing actually these kinds of things. Now, when we talk about metabolic, nervous, and vascular, so the central idea is there will be disturbance of metabolism, there will be disturbance of nervous origin, or there will be some vascular origin. But in that central thing is the thing that get affected is development. There will be developmental arrest, or at that age something was to develop which is not developing, and then the symptoms of metabolic symptom, nervous symptom, or vascular symptom is coming. So I told you in my first PPT itself, the central point is development, and the expression of it could be metabolic, nervous, or vascular symptoms. So keep this in mind. Okay, this slide is the most important slide in this talk. Now we'll go from different age groups. Let's start with infancy and try to understand what the author is trying to say. Infancy and childhood. This is a period when vital reactions and rapid metabolic changes take place in the system during the process of child's growth of physics and development of his mind. Now, we all know that infancy and childhood is the age where the development happens, the child grows. You talk at the physical growth, you talk at the development of the mind. It is on the rapid phase. A lot of changes, metabolic changes happen and very rapid. Hence, there are a great possibility of maladjustment in the functional equilibrium of the organs and disturbance in metabolism. So this is the age where there can be lot of maladjustments. There could be hindrances. There could be block of the functional equilibrium, because this is the age when the metabolism is very high. The changes that is happening in the body is very high. Physic, the body physic, child's growth, all the development aspects, that the mental symptoms, the mental development. So when the development is very high, there is a chance that if any disturbance happens here, this can halt the development of the patient or the child. As a result of which, various chronic or subacute sufferings and illness are met with this period of life. That is why when you think of giving thyroidinum, or majorly thyroidinum is indicated in majorly in infancy and childhood. Very rarely we try to find out these symptoms. So you will find maybe today patient has come to you, she or he is of age of 20, 30, 40. But when you go in past, you'll understand that this child was having a lot of metabolic or vascular or some nervous symptoms during childhood, during the period when the metabolism was high. So that could be one of the indications for thyroidinum itself. Let's talk about one symptom, that is convulsion. Now, convulsion is one, like I said, metabolic, nervous, and vascular. In nervous, convulsion, seizures is one of the symptoms, one of the disease per se, which you can see is one of the sphere of action, you can say, of thyroidinum. But let us try and understand what type of convulsion and how it is known. Especially convulsions of newborn babies. When you see convulsions in newborn babies, but it is not due to any trauma during delivery. Whenever convulsions come in children, in infants basically, or newborn, the number one cause could be trauma, physical injury that can happen during the delivery. And second is fever. So here it is not attended with high rise of temperatures. So what is the characteristic convulsion of thyroidinum? No obscure cause. Remember this, no obscure cause means history of trauma was ruled out, and even there is no high rise of temperature. The parents will tell you, no, my child never got fever, but he used to get fever. He used to get convulsions as he was born. So he was admitted for that. Another thing, of course, when we talk about infants, infants are directly connected to the mother's state during pregnancy. So what about mother? There has to be something suffering for mother also. So mother suffering from eclampsia, or one of parents suffering from various nervous metabolic disorders, or when the cause is obscure. Hence, when you will find out that the mother had eclampsia during pregnancy, number one. Second, or you can find out one of the partners has some metabolic disease. Maybe somebody has diabetes, maybe somebody has a thyroid disorder, or maybe somebody has a history of convulsions. So this is metabolic disorder. Or maybe some other metabolic disorders, right? Or at last, the cause is obscure. You find clean history in mother's history, personal, like, family history, father's and mother's history during pregnancy, all is clear. There is no cause. That could be one of the indications of this. And still convulsions coming. So convulsion of children during dentition without fever. So infant we talked about. Another age which is very critical is teething. Because when teething happens, dentition happens, there are high chances that children get convulsion. And usually it is because of fever. But here in thyroidinum, the child will get convulsion, but this convulsion is without any fever. So there is no inflammation anywhere in the body, but still he is getting convulsion. This is called metabolic disorders. This is called nervous origin, the development. So I told you, right? In the center, there is developmental issue. It is development. Development is happening. Teething is development. child is growing, that is development. Disturbance there happens, and it is the symptoms are thrown out in nervous phenomena, vascular, or metabolic. Another thing, as I told you, metabolic disorders, the symptoms could be headache, vomiting, nausea, high rise of temperature, a lot of sweating, flushes, and then feeling coldness. Okay. So nausea and vomiting. As we said, we talked about convulsion. Now you know what is the characteristic of convulsion of thyroid. What about nausea and vomiting? So there is nausea and lot of nausea and vomiting. In fact, it is said that this is the keynote of thyroidinum. Nausea and vomiting is the keynote of thyroidinum. With any disease, particularly when it is chronic. So when you're thinking of giving thyroidinum, just go and ask about nausea and vomiting. And many times patient will tell you, yeah, I had a history of nausea, vomiting, especially when they are suffering from some chronic disease. Vomiting of babies after birth is generally accompanied with serious repercussion in the growth of the child. It is said that if suppose child is born, infant is born, and infant starts vomiting, of course they will put in NICU, they will control everything. But it is seen that when at that stage vomiting happens, definitely there is some effect in the growth of the child. You'll see some abnormality, you'll see something, some developmental arrest in the child in terms of walking, speaking, mental faculty, physical growth, anywhere. So now you're understanding the developmental part. So there is a problem. The main sphere of action is the development, but it is shown through the symptoms of the metabolic symptom, nervous symptom, or vascular symptom. In children's, generally through convulsions, maybe, or maybe vomiting and nausea. Jaundice of newborn babies. It is very common, to get jaundice like newborn babies. And I have seen that majorly when mothers suffer from diabetes, mothers suffer from thyroid, mother suffers from some metabolic or nervous system disease, there are high chances that the newborn babies can get jaundice. Generally, jaundice gets cured, right? It is easy, not life threatening. It is a common practice to get a lot of children get that. But this could be one of the faint hint. So if you have the background of it, which I talked about, and then the jaundice of the baby, this could be one of the reasons to prescribe thyroidinum. Now, what we'll do is that I've shared you a small snippets. We'll take some cases. I've taken cases. I have my own personal cases also, but I thought let us take cases from the book itself first. And maybe, I'm going to come with the second part where I'll share my own case. I might share on that cases. So let us see one case and few cases. When you understand these cases, these cases will help you to understand better what I'm talking about. An ill-developed baby, aged 10 days, came to them. The baby developed loss of voice without any difficulty in swallowing. So what happened? 10 days baby came, suddenly voice lost. They're crying, no voice is coming. But baby was eating like drinking. Of course, they are drinking milk only in 10 days. So sucking and everything is there, no problem in swallowing. On examination, no cough, no catarrh symptoms, no fever. So the child is absolutely fine. There is no discomfort, no disease, no inflammation, no allergy, nothing. Respiration was also, in fact, intact. Stools were somewhat little diarrhea. So little diarrhea was there 6 to 8 times a day. That was the only concern. Few medicines were given without any help. Then thyroidinum 33 doses, 1 dose every 12 hours. What happened? Why thyroidinum was given? Considering that the condition might be paratic or underdevelopment of vocal cord due to defective growth. What a case, what a case. So the physician thought, they gave some remedies, they tried, because there was no cause, right? No inflammation, no disease. So what happened here in this case? Defective growth. Infant, what happens to the vocal cord in the infancy? As other parts are developing, The vocal cord is also in the frame of development. That's why, child does not speak. They're just crying in the beginning. Then slowly, they are able to speak. The vocal cord is developing its strength. What happened? Maybe paralysis happened. Maybe development got stuck. But problem with the defective growth, the growth got hampered. So whenever in the body, some growth has to happen and there's a problem in that growth and it gets halted, thyroidinum is the remedy. So thyroidinum was given. What happened after remedy? Voice improved completely. Diarrhea was also controlled. And of course, with little change in the diet, the child improved with great deal. Diet in the sense, mother's diet. Because when mother's diet is proper, sometimes mother's disturbance goes to this 10 days children, infant, that. Second case, defective nervous development. This cases. Now, this is also very interesting case. A newly married girl, age 18 years of age, she was just 18, who was 100% normal, absolutely normal, apparently, before marriage. She got married. What happened? Her husband came to me for consultation regarding his wife. What was the problem? The wife was having convulsion towards the end of the coition. Now, this is interesting, right? Of course, you can go and see in repertory convulsions during coition, end of the coition. You might get some rubrics here and there. In this case, he gave, she was absolutely normal, intelligence, proper physical development, everything was normal. So the physician, how did he analyze the case? It was her defective functional response to the stimuli, which I thought. When everything is normal, everything, huh? There's no obscure cause. Still symptoms are there. In terms of development or in terms of defective functions, then you understand. Now she was 18 years, right? So young she is. The sexual things are developing. She got married at that age. Maybe she had not been into this act of the sexual act. She might have not been there. This was first experience. And then what happened? This is also sexual development that functionally she should develop. So stimuli is coming, but the body is not ready, not strong enough, or not ready to give proper response. This is functional development, defective functional response to stimuli. To be responsible for this condition, a dose of thyroidinum 200 was enough to strengthen her nervous system and make her competent to enjoy the delight of orgasm. When I read this case now, I said, wow, now I understand. After the infant case, now listening to this case, now I'm little slowly understanding what exactly author is trying to say when he says developmental issue, metabolic, nervous, or vasomotor symptoms. Let's go ahead. Now, what are other indications? Let us understand the other indications. In chronic obstinate diarrhea of undernourished children during dentition. Again, dentition. Now, diarrhea is there. Okay. We have remedies like chamomilla, senna, so many other remedies we have. But thyroidinum could be one of the remedy if your chamomilla and senna does not work. And undernourished children, especially undernourished children, means you will see the child is weak, thin. In Medorinum also we said that lacks nutrition in spite of eating well. That is the first symptom that I spoke. But there is a definite cause. There is anemia in the background. Because of anemia, they are weak. But here there is no anemia. Everything is absolutely fine. But still the child is undernourished. And he gets constipation and diarrhea. So thyroid. Metabolic disorders such as marasmus. Of course, marasmus and ricket. That is purely a metabolic disorder. So if you get a chance to treat these patients, maybe looking into other conditions, you can think of thyroidinum as one of the greatest remedy. Other physical symptoms. We should also know our nosodal remedies like thyroid, medorinum, puja, nitric acid, sulfur, other remedies, mercury, syphilinum. through physical expressions also. So what are physical expressions of thyroidinum? Puffiness of face, swelling. You'll find swelling, face, edema of legs, general anasaka. Like epis, when I'm not saying you give epis, but just a thought came to me that when you think of epis, whenever there is dropsy, anywhere you see dropsy or swelling, collection of fluid, you think of epis also. But here also you say puffiness of face, edema of leg, general anasarca. You will get patients, they keep saying, my body is bloated, doctor. My body is bloated. Another remedy for bloating sensation is Bovista. Bovista is one of the very good remedy for that, female remedy. But patient will say, my rings are tight, my clothes are get tight, bloating is there, bloating is there, bloating is there. So, and then puffiness you see. General anasaka, general swelling of the body is there. Thyroidinum could be one of the remedy. Here they say thyroidinum wise with creosote when several teeth try to erupt at the same time. Again, developmental issue. So child, see, one teeth comes, right? One teeth will come, but there are times when it can happen in thyroidinum that several teeth are trying to come at the same time. And then the child is having a lot of difficulty, pain he is having, diarrhea he is having, again, developmental problem. A lot of teeth are trying to develop at the same time. Thyroidinum could be one of the remedy. Vomiting with chronic diarrhea in children should always remind a physician of thyroidinum impotence. Metabolic, right? Metabolic. So if the child is there and you get a history that the child is having, whatever they do, vomiting keeps happening, chronic diarrhea is there, you think of thyroidinum, one of the remedy. Family history. Diarrhea of newborn babies when one of the parents, so diarrhea and vomiting is very important, but one of the parents suffered from diabetes, number one. Allergic troubles. Now, allergic troubles are also metabolic problems sometime, or maybe, nervous or vasomotor problem. So allergies, any kind of allergy, suffering from coryza, bronchitis, asthma maybe, or skin allergies, or such other obscure conditions. Other symptoms. More chronic the diarrhea, better it is indicated. So vomiting, diarrhea, keep it in mind. Thin, emaciated, anemic subjects with edema of extremities and face. You will say anemia, medurinum. Yeah, medurinum. But edema will not be there. Metabolic disturbance will not be there in medurinum. Excessive appetite, or they may want of some appetite sometimes. So in appetite, you can get both sides. Want of appetite or excessive appetite. Nausea, vomiting, we already talked about. Stool liquid, not much. It may be offensive, but not like sorinum. These are rare things, like not much indicated. Aldolism. So in adolescent age, thyroidinum has a wide range of action on abnormalities of menstrual and functional or organic troubles accompanying menstrual cycle. As I told you, metabolic disorders. So when you see menses coming, you will have a lot of premenstrual symptoms, or during menses, a lot of metabolic changes happen or symptoms aggravate. So abnormalities of menses, menstrual cycle, thyroidinum could be one of the remedies, because thyroid, in fact, the thyroid hormones have direct affection of female hormones. They affect the menstrual cycle. So what are the indications? Let us understand. It is very usual to find slight aggravation of all symptoms during menstruation. So it is common, right? But any constitution showing an abnormal aggravation of various troubles during menstruation should be considered as very good field for the action of thyroidinum. Little bit trouble during menstruation, many females have. But if there is lot much aggravation, the lady will tell you that, doctor, during my menses, I am so much troubled, I can't tell you. The pains and aches are there, but this nausea starts happening, vomiting starts happening, flushes start happening, sweating happens, my blood pressure rises. So it is abnormal. Abnormal aggravation during menstruation. You should think of thyroidinum as one of the remedies. So during menstruation, what are the concomitant symptoms, the guiding principles. So you will get mental irritability, extreme mental irritability, whimsical mood, hysterical tendencies, various vasomotor disturbances such as vertigo will happen, chronic headaches will happen, even convulsions can happen during menses, flushes of face can happen. So what are these? These are concomitant symptoms. So emotionally, mentally, patient is irritable, angry, whimsical, hysteria, mood swings are there. And vasomotor, I told you, vertigo, headache, convulsion, flushing of face. Thyroidinum was in a case of a girl who was given in a case of a girl who was having painful inflammation of joints occurring each menstruation since the first appearance of her menses, but without any rise of temperature. Now, this is very interesting. In one of the case, there was a female who used to have a lot of inflammation, lot of pain in the joints every menstrual cycle she would have, but there was no rise of temperature. Again, I told you, right? No inflammation in the background, no obscure cause. Thyroidinum helped to that patient. It is used for irregular and scanty menstruation in young girls where it regulates the flow and relieves the pain to great extent. Menorrhagia and metrorrhagia, it can be used when indicated remedies fail to have permanent effect. There are so many menorrhagia and metrorrhagia fail, but its main field of action is in case when bleeding continues unusually longer or stops and comes in the fits and starts. What is the concomitant? The vasomotor and nervous disturbance. So lady will tell you, I've been bleeding, doctor. I've been bleeding, doctor. You tried many medicines. It is not under control. And then suddenly you see that vasomotor symptoms are coming. She's having nausea. She's having vomiting. She's having diarrhea, headache, vertigo, flushes of heat. Some puffiness happens, swelling happens, bloating happens in the body. Then you think of thyroidinum as a remedy. Now we come to amenorrhea. Now this is one of the very, very common thing in today's life. And it is really tough to cure amenorrhea. In amenorrhea of hyperpituitarism in female, no better remedy than thyroidinum, but here impotency must be used. So if you see signs of hyperpituitarism, then maybe in amenorrhea. So patient has symptoms of hyperpituitarism and patient is amenorrheic, maybe you think of thyroidinum. It is considered almost specific for cases of amenorrhea and scanty menstruation due to complex endocrinal imbalance. So if the lady is having amenorrhea or she's having scanty menstruation and there is hormonal issue, means endocrinal disbalance, means maybe she has a thyroid problem. Suppose a lady comes to you with amenorrhea, has thyroid problem. You can definitely think of thyroidinum. Or she has scanty menses and she has thyroid problem. Thyroidinum could be thought of. Clinical tip. Thyroid should be thought of in persistent types of menstrual irregularities where indicated remedies fail to respond. So you know that, right? NoSOD is not given first hand generally. First you try your indicated remedies. If you fail, then maybe you can think of these. Higher potencies act best to regulate the menstrual flow when it is excessive and prolonged. So when you want to tackle this menses issue, flow, menorrhagia, metrorrhagia, high potencies. Lower potencies, not above 3x, acts best in case of amenorrhea. Now these are his understanding, like his experience that he shared. Of course, you can have your own understanding and your experience. Now we come to menopause. So we were talking about females, so we talked about adolescent, young age. We talked about infancy also. Menopause, as we see, metabolic symptoms are more. Now, menopause is one area where actual physiologically metabolic symptoms are there. You will see sweating, high flushes, nausea, vomiting, a lot of things happen. It is metabolic symptoms. And lacasis is one of the remedies which often come there, right? How do we differentiate? Thyroidinum as a complementary remedy to lacasis when it fails or it partially relieves. So in menopause, if you're giving, if symptoms corroborate and you think of lacasis, you're giving lacasis, it acts good, but after a while it stops acting, you can try thyroidinum. Regulates concomitant vasomotor and nervous symptoms. At least the disturbance that, the flushes and all those things that's happening, that can subside. Palpitation, dyspnea, nausea, vomiting, or any other vasomotor troubles such as vomiting, such as vertigo, etc. Controls heavy and prolonged hemorrhage in multipara. Mental disturbance or hysterical troubles. Now we come to pregnancy and its complication. It is wonderful remedy for pregnancy if you understand. It rectifies innumerable defects of gravid uterus. Listen to me carefully. It rectifies innumerable effects of gravid uterus as well as various other complications of pregnancies arising from enhanced metabolism arising out of enhanced metabolism and maladjustment and for maintenance and growth of fetus. So again, it's a very good remedy for where you have a problem, where you have a past history that growth of development of the fetus does not happen. Means early abortion. There is history of early abortion. There is tendency to premature labor when the cause is not mechanic. Origin, it may be due to retrovirus uterus, maybe. Repeated abortion and threatened abortion. You will see some ladies, they have got great history of abortions happening, threatened abortion, repeated abortion, and premature delivery is happening. So what is happening here? The child, the womb is not able to sustain. The child is not able to develop fully. And you see some metabolic things coming up. You can think of thyroidinum. Repeated premature delivery with no obscure cause. There are ladies, will come and they say, oh, doctor, maybe they will have normal children now, but they will say, oh, doctor, I've got 2 or 3 kids. All have been premature. Now, why all the children has to be premature? There is definitely defect in the uterus or in the female's economy. Now let me discuss a very interesting case. A lady aged 24 years came to me for treatment of very neuralgic pain in the right leg. So there was a neuralgic pain in the right leg. Maybe looks like sciatica or something. With partial atrophy and paretic weakness of the limbs since 1 year. So there was some atrophy and there is some difficulty in, paretic weakness was there. Movement aggravated pain, but she got relief to some extent by rest. She took large number of injections of vitamin B, liver extract without any improvement. She used to take analgesic powders for palliation of the pain during its aggravation without much relief. She had scanty menstruation with some pain in lumbar region. So what did the physician do? Of course, you can take the totality, you can take modalities and everything and that Patrizian form, get a remedy. But he went into the past. And this is what he found out. History of termination of pregnancy. Why? Because of premature deliveries. So there was termination of pregnancies. They had to terminate. Some premature deliveries happened. She used to have labor pain precipitated too early, nearly like 26 to 28 weeks. That is why abortion used to happen. Threatening early delivery, which could not be prevented during first gestation. But in later pregnancies, by injections, the conception was taken care and then up to few weeks more, not up to full term. Even with the injections, the child would not go to the full term. And then, prematurely they had to deliver the baby. On this indication, thyroidinum was given and entire pain and weakness, whatever happening in the legs, completely got better. In fact, the menstrual flow also got better. Okay. So clinical tip. Now let's few slides and then we are ending. So Ghosh says that I've used it with success to help conception in obscure cases of glandular disorders and also in cases of endometriosis with menstrual disorders where curating had failed to improve. So it is a great remedy for conception issue where there is some gland disturbance involved. Maybe thyroid gland is involved or some other glands are involved, especially hormonal. Endometriosis is happening, but curating is not helping. The value of thyroid in endometriosis causing sterility or abortion with menorrhagia and pain during menstruation. So remember these things. Sterility is there, repeated abortions are there, premature deliveries are there, and there is a lot of pain during menstruation. If these components you find out, you think of thyroidinum as a remedy, as one of the remedy. Okay. So Common symptoms. Now, I'll just go through fast symptoms. Vasomotor disturbance, generally, physiologically, what do you mean by vasomotor disturbance? I have already explained, but I'm just trying to brush it up. Vasomotor disturbance refers to the problems in the body's ability to regulate blood flow and body temperature. They are most commonly associated with menopause and perimenopause, but can also occur during the conditions such as hypertension, anxiety, and certain neurological disease. Common symptoms: hot flushes, sudden feeling of warmth, often intense, especially face, neck, chest, night sweats, hot flushes that occur during sleep and can disrupt sleep, sweating, excessive perspiration, which can be intense in some cases, skin flushing and blotchiness. Skin may appear red or blotchy during hot flushes, increased heartbeat or heart palpitation. Some individuals may experience racing heartbeat. I had a patient, where she gets sudden palpitation, and she has to sit down. 2D echo, ECG, everything is done. Everything is normal. And she's a case of adenomyosis of uterus. So I have helped her with the tumor, that has completely gone, shrink. But now what has happened is that I asked her to do thyroid profile and TSH was raised. Sudden palpitation, no cause. So I gave thyroidinum 1 and it has really helped, really helped. So dizziness, vertigo, all this. So by definition, commonly, I'm not going to go again and again. So that is what is thyroidinum. And this is just part 1. I will come with part 2 and I will continue, give you more insights about thyroidinum, because I feel this is one of the remedy, is one of the nosodes and we should learn properly. And once we get a knack of it, once we get an understanding of it, we can see it in day-to-day practice a lot. And many patients, we can help them to get rid of so many complaints. Many of our stuck cases, there are many of our cases which are stuck. We can help them to get out of it. So I'm done with it. Thank you very much. And we'll be back with part 2. Thank you.